Today is Friday, 12th of April. We have a packed agenda and just 1 hour to go through it because, as you know, Jens will be here. I'll happily give my seat to him in 1 hour at 11:30 for a press conference by Jimmy McGoldrick, who is terminating his tenure in the OPT and want to talk to you about the situation and the humanitarian situation there. So let me just start by introducing you to Celinde Dulkait, who is the Chief Media and Communications of UNFPA, and she's just here for introducing herself and remind you of the press conference of Monday. Celinde.
Thank you. Good morning. Yes, my name is Celinde Dulkait. I'm Head of Communications at UNFPA, the UN Population Fund, which is the UN Sexual and Reproductive Health Agency. And just a quick announcement to say that we will be launching our flagship State of World Population Report on Wednesday. Wednesday is when the embargo lifts. However, we will be having a press briefing here on Monday at 2:30. So it's an embargoed press briefing, which gives you time to prepare your reports before the embargo, which we hope you will do. The report is called Interwoven Lives, Threads of Hope, Ending Inequalities in Sexual and Reproductive Health and Rights. And it looks at progress made and how far we've come and how far we have yet to go in achieving those rights, who's been left behind and why. So again, that press briefing is at 2:30 here. You should have all received an email from Alessandra. And if you would like to receive the report in advance, there's an email address there from my colleague, Eddie Wright, at unfpa.org. You'll find it in the email. So please reach out if you'd like the report ahead of time. And we look forward to seeing you on Monday. Thank you.
Thank you very much. As I told you last Friday, this is the first, to the best of my knowledge, the first or maybe one of the first times that UNFPA launched its flagship report from Geneva. So we really hope that we will get a lot of coverage. And as Celinde said, because of Tuesday, and we're expecting a few good news, no, maybe not good, but I mean important news on Tuesday at the briefing, the fact of having the embargoed press conference on Monday should help you cover the report that is going out of embargo, as Celinde said, on Wednesday morning. So thank you very much, Celinde. Good luck with the launch of the report. We are available to send you again the information about Eddie Wright if needed. And I will quickly go now to my first speaker, who was brought to us by Sarah Bell of UNDP. We have with us Tahir Shraideh, who is the country representative in Sudan for UNDP, and who has a few new findings of their report on the livelihood in Sudan. So,
thank you very much, Alessandra. We're going to go very fast. Our resident representative in Sudan, as Alessandra mentioned, is here to brief you on the assessment of the social and economic impact of the ongoing armed conflict in Sudan on rural communities. We're publishing today a new report titled Livelihoods in Sudan Amid Armed Conflict, Evidence from a National Rural Household Survey. I've sent you, just before the briefer, the press release with all the statistics. The study is the outcome of a collaboration between UNDP and IFPRI, which is the International Food Policy Research Institute. It is based on a comprehensive survey of more than 4,500 rural households across the entire country. Tahir, the floor is yours to present the key findings of the report. Thank you.
Thank you, Sarah, and thank you, colleagues, for having me. Indeed, actually, Sudan faces an accelerating food security crisis. Our study highlights that 59% of the households surveyed face moderate or severe food insecurity, with highest prevalence in the states of West Kordofan, South Kordofan, and the Blue Nile. The study warns that a famine in Sudan is expected in 2024, particularly in the states of Khartoum, Al Jazeera, and in the Darfur and Kordofan regions. The food crisis is rooted in problems of availability, as food production and supply chains have been disrupted by the ongoing war, but at the same time, as well as it emanates from an increasing lack of affordability, as households have been or have seen their livelihoods and incomes dwindle or cut down because of the war. On the availability, the study shows that over 71% of households do not own agricultural land. They can cultivate to feed their family. Over 70% of respondents indicated that they did not cultivate any land during the 2023 summer season, and half of the households that reported cultivating lands indicated that their farming was disrupted by the conflict. A quarter of the rural households surveyed reported that they were not able to visit markets due to physical barriers, economic limitations, or safety issues. On affordability, inflation is high on basic products that are essential to Sudanese people. 43% reported being unable to make essential purchases. 64% of those citing high prices are the primary barrier. The study also observes that the current conflict has severely disrupted rural household incomes, employment, and livelihoods, resulting in widespread economic instability. A significant of 36.9% proportion of households experienced a shift in income-generating activities, with 15% transitioning from employment to no employment. Nationally, income has dropped for 60% of sampled households, with alarming incidents of complete income loss, particularly in conflict-affected areas. The findings show income reduction of over 50%, with some sectors such as mining experiencing a dramatic drop of over 90%, highlight the gravity of the situation. And the conflict has also exacerbated existing pre-war vulnerabilities related to housing and access to infrastructure and access to services. Most households live in inadequate housing conditions, with disparities in access to water, electricity, and sanitation services posing additional challenges. Rural households have low access to assets, including agricultural land, which further complicates their livelihoods. The study calls for immediate humanitarian and food assistance for households facing severe food insecurity and income loss, but that may not be enough to stave off the looming famine. The study also calls for concurrent and urgent support to agricultural livelihoods, focusing on providing farmers with access to subsidized inputs like seeds and fertilizers, rehabilitation of irrigation infrastructure, and rapid training programs on resilient farming practices. Both critical and complementary tracks, immediate life-saving, humanitarian aid, and early life-sustaining development recovery efforts are necessary, and they are necessary now. Thank you for having me.
Thank you very much, sir, for this update. Let's stay on Sudan. We have got 3 speakers today on Sudan. So let's go to IFRC, and then we have Christian with an update, and then I'll take questions on the situation in Sudan. I'd like to ask everybody to be brief, please. So let's go to Farid Abdul Qadir, who is the IFRC head of delegation for Sudan, who is reaching out from Mombasa.
Thank you very much for inviting us. Today is 3 days before the 1-year mark since the war started in Sudan. As we speak today, over 8.6 million people are displaced. 1.8 million are outside Sudan, while almost 6.4 are inside Sudan displaced. 1 year later, and as our colleague Thai had explained, a lot has changed in terms of the situation getting worse. We have a health system that is not able to provide adequate services to its population. You have a lack of supplies of medical equipment. You have staff or medical staff who are displaced, and some are inside the country, some are outside the country. We are talking about a situation to date that almost 17.7 million people are in need of food assistance, while over 700,000 children are at risk of being malnourished. The humanitarian consequences of the war is dire. It has affected the infrastructure in terms of water supply, in terms of electricity, but worst of all, the people engagement in livelihood and food production, which has both impact now and impact in the future. We are also looking at an infrastructure that has already been, destroyed. Some areas that are functioning at a very minimum rate, including that of Sudanese Red Crescent, where the headquarters vehicles have been looted. So they're operating in a very challenging environment. However, the Sudanese Red Crescent Society has mobilized over 40,000 volunteers. 3,000 are working at concurrently throughout the 18 states. Since the war started, the volunteers have been working round the clock, and these are volunteers that are coming from the community that they serve. They've been providing food services, healthcare, provision of clean water, support with dead body burial of dead body, ensuring that they are buried in a dignified way and able to be identified when the need arises. We are also looking at a situation where children right now are being supported, of course, in some area, but a number of them are at very high risk, as I explained. So far, the figure given is over 700,000, and with the time, it will even get worse. The Federation, the Sudanese Red Crescent, are calling upon all parties in Sudan to sit and reflect on the challenge and humanitarian challenges that the war has caused, because despite any support that will be mobilized, or the current humanitarian support that have been mobilized, which is at like 10% of the total required resources, nothing will be able to fill these gaps if the root cause is not addressed. So it is calling upon all parties to deeply reflect on the humanitarian challenges the action has taken, and to look at the greater nation and how to be able to address these humanitarian challenges through at least ensuring that the ceasefire is called for and people sit and dialogue to minimize, avoid, and ensure that the Sudanese who are currently suffering both inside Sudan and outside Sudan are able to move back to the normal way of life and to move back to where the homes are and to start rebuilding their country. So as International Federation of Red Cross and the Red Cross Red Crescent movement, we are calling upon all parties to sit down for the sake of humanity, for the sake of the people and the children that are suffering, so that we can be able to together sit down and look at the ways of recovering and ensuring that the community, the families are able to recover from the crisis that have almost taken 1 year to date. Thank you very much.
Thank you very much. Thank you, sir. Stay with us for the question and answers, and I'll go to Christian now for an update from WHO on Sudan.
Yeah, thank you, everybody. Time is running out. Without a stop to the fighting and unhindered access for the delivery of humanitarian aid, Sudan's crisis will dramatically worsen in the months to come and could impact the whole region. We are only seeing the tip of the iceberg, and the situation could be much more dire in reality. Access for humanitarian actors is particularly constrained, as has been reported so many times by all of the colleagues. Half of the states are not accessible from within Sudan. Darfur and Kordofan are inaccessible and cut off from humanitarian aid. As the world is grappling with multiple disastrous crises, Sudan remains an underfunded crisis. The humanitarian response plan appeal for health is only 17% funded so far. 17. Next week, on 15 April, our Director General, Dr. Tedros, will take part in the Sudan International Humanitarian Conference. Now, a few key figures, and yes, I will share those afterwards in my notes. Every second person, or 25 million people, are in need of humanitarian assistance this year. This is 9 million more than last year. 15 million people are in need of urgent health assistance. An alarming 18 million of people are facing acute food insecurity, that's IPC 3+, with 5 million people on the brink of famine in areas affected by the conflict. With the lean season expected to start soon and without unhindered access for aid, the situation will only worsen in the coming months. 3.5 million children, that's every 7th child under 5 years, is acutely malnourished. 230,000 children, pregnant women, and new mothers could die in the coming months due to hunger unless urgent life-saving funding and aid address their needs. And that's according to Save the Children. 70 to 80% of the health facilities are not functioning due to the ongoing conflict. Attacks on healthcare during the war have left more than 25% of all hospitals non-functional. 62 attacks have been verified by WHO only the last year, resulting in 38 deaths and 45 injuries. Medical supplies in the country are estimated at about 25% of the need, and for several months there has been a general crisis in medical supply at all levels of the health system, with increasing drug prices and depleted pharmacies. This means that people suffering from diabetes, hypertension, cancer, or kidney failure experience and even die from severe complications due to the lack of treatment available. Some states, such as Darfur, have not received medical supplies for the past year. Disease outbreaks are increasing in the face of disruptions of basic public health services, including vaccination, disease surveillance, functions of public health laboratories, and rapid response teams outbreaks, as we see them of over 11,000 cases of cholera, over 4,600 cases of measles, 8,500 cases of dengue, 1.3 million cases of malaria, and so on and so forth. Time is running out.
Indeed, Christian, and thank you very much for this update on the health side. And I just would like to add, as Christian has reminded on Monday, also the Assistant Secretary General for Humanitarian Affairs, Joyce Msuya, will also be in Paris alongside Dr. Tedros and other UN officials attending this conference that Christian has referred to. It's the Humanitarian Conference for Sudan and its neighbors. France, Germany, and the European Union will be co-hosting this press conference where Mrs. Msuya will advocate for scaled-up resources to expand our operations in Sudan and in the region as a whole. She will also advocate for improved humanitarian access so that agencies can ensure the timely delivery of life-saving supplies, which we have heard is particularly difficult to the communities in need. And we will have also a message from the Secretary General for the conference. And I'll conclude this part on briefing on Sudan by saying that the UN fact-finding mission on Sudan has released some heartbreaking figures, much on the line of what our colleagues have said, and I would invite you to consult their website for the details. So let's open now the floor to question for our briefers on Sudan. Is there any in the room? And I don't see any, so let's go to the platform. I've got Lisa Schlein, Voice of America. Can you please, Lisa, tell to whom you address your question? Thank you.
Hi, to anyone who has a good answer. I know that you, Christian, we have tamed you, so you will send us your notes. But thank you. But could I ask the IFRC and UNDP representatives to do the same, and as soon as possible, not at the end of the day when deadlines have been missed. Thank you. As far as the question goes, I heard that an interview with somebody from NSF, from Doctors Without Borders, that said that actually famine is happening in Sudan. He mentioned a city. I'm sorry, I don't remember the name of that. But what do you know about that? Is it, yes, and he said 1 of 3 children very young children were dying, which is kind of beyond words. So what do you know about that? How close are we to this happening? And then representatives speak about negotiations and the importance of ceasefires, but is this a possibility, or are the generals really so entrenched in what they're doing in their power grab that this seems to be a distant hope? Okay, thank you.
Thank you very much, Lisa. I don't know who would like to take. First of all, the notes, UNDP Sarah tells me that she has already sent them out. So I hope Christian and Tommaso will do the same for the other two speakers. Yeah, I see, Mr. Abdul Kadir, I saw your hand up. Would you like to start answering?
Okay, thank you very much. Probably I was taking my notes, but nevertheless, I think the truth and the truth and nothing but the truth is that the humanitarian challenges in Sudan are a lot. I mean, even without the war, we already had a food deficit in the country. Today, we are talking about 18 million or 17.7 million, 18 million, as Christian has said, of people in need of food assistance. And with the war, without any doubt, it has and will affect the food production in the country. So we are actually looking at a critical situation because one, livelihood have been disrupted, food production has been disrupted, entirely dependent on external aid to feed the population. And you've heard about the funding levels, both in the UN, the Red Crescent movement has been very minimum. That's why the call for ceasefire, the call for people to sit down and look at the humanitarian consequences of their action and to try and ensure the Sudanese people suffering are put to an end. The Sudanese people have suffered enough. The challenges ahead are even bigger because people have to recover from the current crisis. But the situation is that, yes, war causes challenges, war causes disruption, and the climate change has not stopped doing what it does.
Thank you very much, sir. Maybe, Tahir, you would like to add something?
Thank you. No, I just wanted to add that the possibility for a famine is absolutely there, considering that there is a severe reduction in the production of food in Sudan, plus as the numbers I was mentioning in our analysis or assessment, socioeconomic assessment, that the income also was affected negatively for most of the households in Sudan. So definitely, I mean, if we do not do something now, we will be heading towards that direction. And this is where I hope the politicians and the parties of the war will realize the impact of this war on the normal Sudanese lives.
Thank you very much, sir. Let me go to another question from Yuri Aprelev, RIA Novosti. Yuri, good morning.
Yes, good morning, Alessandra. I think my question is not only for one speaker, but I think for everybody. There is a lack of money, of course, in this conflict. There is a lack of interest from the media and from the governments in general. What do you think can be done to be changed in that? Because every time when we are speaking about Sudan, we all hear the same things, that nothing is funded. Nobody is trying at least to cover this. I'm not speaking about the media, I mean about the government at the same time. This is not a crisis where we are hearing big leaders talking about. So what do you think that can be changed, and what will be the consequences if nothing's changed? If, for example, the money that you are asking is not coming and you will stay at 7% or 11% of what you are asking. Thank you.
Thank you very much, Yuri. I think you're absolutely right. That's a challenge for all of us, for us and for you, of course, also to keep the interest alive in crises that are not necessarily under the the limelight, but I of course ask my colleagues to answer. But I think this humanitarian conference for Sudan 1 year after the start of the conflict is exactly the kind of initiative of the international community that we are expecting in order to bring the attention to this crisis that, while being forgotten or sidelined, are extremely important. As we heard, the numbers are just heartbreaking. So I don't know, I will ask maybe Tahir or Christian or Farid to answer. Just, I see Tahir's hand. Go ahead, Tahir.
Thanks. In fact, I just wanted to re-emphasize that, yes, if there is no action now, it will be, I mean, the consequences will be really catastrophic. More than 25 million in Sudan now, they are being recognized that they need assistance by the UN standards, and it is the biggest crisis in the whole world, but it is not getting enough media attention, considering that there might be also other international crisis in the world that might be more interesting for political reasons. But indeed, Sudan is the biggest humanitarian crisis in the current time. I think if we do not do something now, the crisis within the country will be enlarged. More people will be in need. And I think the impact of this crisis will cross the borders very soon if we do not really step up for a crisis in this size. I imagine the Sudanese will have further complications inside, but also there might be also greater impact fleeing outside of the country if we do not do something that can save the situation.
Thank you very much, Tahir. I don't know if our two other speakers. Yeah, Farid, I see your hand.
Thank you very much. I think, as Christian said, the WHO is doing its part. As Ty said, they're doing their part on our side. And as we said, we're doing our part. If there is less media attention to the world's biggest humanitarian crisis in terms of displacement of population, if the humanitarian world has done their part, the media also has their part. So I would ask the esteemed journalists to ask the question, what have you done to ensure you highlight the challenges that are being faced today in Sudan and other parts of the country? How many people should die? How much suffering should happen until then you revive and you highlight and profile? You're the ones with the cameras, not us. Two, I think it's also time to deeply reflect on the current humanitarian challenges in the world today. The images being seen, the rhetoric from all sides that you see. It's time for the world to deeply reflect on what is happening in the world today and the humanitarian challenges it's facing. But worst of all, what is the consequences of such challenges in the future? And to the human being who sees a child suffering, or the mother looking for hospital to give birth, or a child who needs food to be able to ensure that they survive the day. It's time to deeply reflect and look at the conscience of a man and what is in this world today that is looking at suffering and all this pain, and they don't feel the urge to support, or they don't feel the urge to extend a helping hand. Is it that the minds that have changed, or is it that the hearts have changed? And it's time to reflect and ensure that humanity put humanitarian needs and the suffering of the people, and it should be a feeling from deep inside. And if it's not, then we should always ask our question is, where are we going from here?
Thank you very much. Let me see if there's any other question. I don't see any. So thank you very much to our speakers. Christian, you stay with us because we haven't finished with you. Catherine, is that also on Sudan? Because I would like to go to the next topic.
Yes, good morning, Alessandra. No, it's not on Sudan. It's regarding the conference taking place on Monday Could you be
Yeah.
kind enough to send, to share with us what the SG is gonna say as soon as you get it?
Yeah, sure.
embargo.
I'd be happy to, but it is about Sudan because the conference is on Sudan.
Yeah,
So,
yeah, but
yes,
I mean,
it is
I'm
on
talking
Sudan,
about the
and we'll
SG.
share with you. Yeah. I'm pretty sure that Jens afterwards will be able to also assist you on this press conference, on this conference. But definitely, we will. If we have it under embargo, we will send it to you, of course. Thank you, Catherine. Okay, so I would like to thank Tahir and Farid for this briefing. As I said, Christian stays with us because now let's go to our next item on the agenda, which is Gaza. And WHO has brought us two of their colleagues from Gaza. And of course, Richard Peppercorn doesn't need introductions. You all know him as the WHO representative in the occupied Palestinian territory. But we also have with us Tanos Gargavanis, who is the WHO trauma surgeon and emergency officer in Gaza. You are extremely busy, Mr. Gavanis, and we are very happy that you took some time to brief the journalist in Geneva. So, Christian, should I give directly the floor to Richard? I see you nodding. So, Richard, welcome. Thank you very much for being with us today. You have the floor for a brief introduction, please.
Thank you very much. Good morning, and hope you can hear me clearly. Greetings from Gaza.
I can hear you loud and clear.
Okay. I would like to focus actually on two issues, on a mission of the 10th of April, day before yesterday, from WHO together with OCHA and UNRWA to Khan Yunis, and then my colleague Dr. Tanos Gargavanis will maybe focus a little bit on his missions to Shifa and more specifically the Shifa hospitals. So on the 10th of April, we visited Khan Yunis, and first of all, I want to stress the destruction in Khan Yunis is beyond belief. I mean, like we had seen it early February when we entered from the west, now we entered from the east, and we crisscrossed through all of Khan Yunis. It's disproportionate to anything one can imagine. It's no building or road is actually intact. There's only rubble and dirt. We saw quite a bit of, this was the E-Day, the first E-Day. We saw quite a few people actually moving, sometimes very eerie, moving into Khan Yunis, sometimes in their Eid outfits, looking for their houses, which of course they couldn't find because most of them are damaged or destroyed, trying to see if they could get anything out of their houses. And we saw other people trying to scavenge for wood, etc., and other issues. I want to focus now on health. So on this trip, we visited 4 hospitals in Khan Yunis, and actually we also passed the WHO warehouse. The WHO had 2 warehouses in Khan Yunis. They are fortunately both destroyed due to the hostilities in its vicinity. So let me start with the most important hospital in Khan Yunis, and actually the second most important hospital in Gaza, the Nasser Medical Complex. And it serves most of the medical specializations. It was a 350-bed hospital, and you might recall in the early months of this conflict, actually provided service to more than 700 people actually in Nasser Medical Complex. WHO also for years support this complex, including the Limb and Reconstruction Center. So the Nasser Medical Complex, they became non-functional after the last siege in February, and I think we reported extensively on that WHO organized, supported with the Palestinian Red Crescent and OCHA, the medevac of the last number of patients and staff. It's around a couple of days, around the 20th of February. So it was then already reported that the warehouse of Nasser Medical Complex was severely damaged and partly burned out. We have now witnessed that the hospital warehouse, which used to supply many hospitals in the south, was burning and actually it's completely destroyed. And an incredibly sad sight to see, because also realizing WHO and partners, we provided substantial amounts of medical supplies, trauma supplies, equipment, essential medicines, which are all gone. Solar panels are missing, the south wall was torn down, etc. We went all through the hospitals, and it's damaged. The hospital is still standing, at least the main buildings, but damage is incredible. It's an incredible mess. Critical assets such as the CT scanner, the ICU equipment, etc. They seem functional, but we have to inspect by biomedical engineer. X-rays destroyed, mobile X-ray destroyed, extensive destruction of surgical material, anesthesia devices destroyed, large hole dug up in the building, etc. The limb reconstruction center, heavily supported by WHO, unrecognizable, maternity ward and equipment destroyed, and so forth. Then Allemaal, PRCS hospital. Immense structural destruction, even more, I would say, than Nassau Medical Complex, and compared to the February 25th, when WHO mission was last there. Ambulances cannot enter or exit, a huge hole, damages in the radiology department, third floor totally ruined, mobile X-ray ruined, etc. 3 out of 5 operational theaters are still functional. The other 2 have been destroyed. The main hospital generator is completely destroyed, etc. It was actually encouraging and also surprising to meet the director, Dr. Haider, and some of the health workers which were present and still took the initiative to treat some trauma and maternity emergency, and they plan to expand the inpatient capacity and to restart some basic services, hopefully the coming week. And Alger Hospital was the 3rd hospital visit, was a private NGO hospital linked to Al Sahaba Hospital in the north, focused on maternal and child health, a little bit like Allemaal. Just want to say, supported by other partners, including UNFPA, 5 floors still standing, but everywhere heavily damaged, smashed, etc., non-functional. The Jordanian hospital is actually the only small hospital which is functional. I would call it minimum of functional. Now, I want to say something, because we get a lot of questions about that, and it's becoming a bit of a topic, and that is good. We get questions about rehabilitation of hospitals and facility. And just to be very clear, WHO and partners, we are ready to support efforts to revive priority functions of key hospitals and pragmatically rehabilitate. And let's not forget that just recently, Al-Shifa, when it was non-functional after the first siege, it became partially functional again. Thanks, first and foremost, thanks to their health workers. Then with support of WHO and partners, it became again like a functional first referral hospital, the trauma center for the north, etc., some dialysis patients, etc. Unfortunately, now not functional anymore. Thanos will refer to that. So we know there's enormous need for hospital capacity. So we plan and we would like to support rehabilitation of these key hospitals like Al-Shifa, like Nasser Medical Complex. Can we assist the Allemaal, the PRCS hospital, Alger, and a number. But for that, first of all, what is needed is a sustained deconfliction to work and to get WHO supported medical, electrical, and water engineers in to do a proper assessment and planning. We need to get, of course, focused on the planning on building material, but also think about heavy generators, solar infrastructure, specific medical images equipment, CTs, MRIs, X-rays, lab equipment, equipment for oxygen plants, and besides what we call the regular stuff, medical supplies, trauma, essential medicines. And it is important to note that before this crisis, it was extremely hard to get any specialized medical equipment into Gaza, X-rays, MRIs, CT scans, or their spare parts. I mean, and I don't even want to discuss large generators. WHO, it took us 2 years to get 3 mobile X-rays into Gaza, mobile X-rays which you have in every referral hospital. So this kind of import restrictions will have to change if you want to focus on any substantial rehabilitation. But more important, we have seen how fragile these gains are and how quickly efforts to restore hospitals, look at Shifa, can be lost due to hostilities and attacks. Look at Nasser Medical Complex. So this is also not sustainable and a huge strain on health partners and of course, our scarce resources. So a lasting ceasefire is, of course, needed to really go forward with meaningful restoration and rehabilitation of the health system. But we, WHO and partners, are very much ready for this. We're planning for that, and we're looking forward to take that road forward. I want to shift now to Thanos, to Dr. Thanos, and maybe some additional comments. He's our trauma lead. He's also the WHO surgeon. So I want to maybe his insights a little bit on our recent visit and specifically on Shifa. Thanos, over to you.
Thank you. Thank you very much, Richard. And I give the floor to Thanos. Please remember, we only have 50 minutes. So if you could be brief, please, because I know there are questions and we will not be able to take them if we don't short it up a little bit. Thank you.
Thank you very much for this opportunity. We are here in Gaza, and while my head of office, Dr. Peppercorn, already explained you the situation in Khan Yunis, I would like to focus on Shifa. Shifa Hospital used to be the biggest hospital along the Gaza Strip. It used to be the center of all specialties besides oncology, even though if some level of oncology treatment was taken there. And unfortunately, what we saw when we went last week to Shifa is that the hospital has been turned into dust and rubble. It has been completely destroyed. Valuable assets like the oxygen plant, like the CT scan, like laboratory equipment, and like critical pieces of equipment that are necessary for all operations, like ventilators, like anesthesia devices, like machines that are required for any doctor to provide life-saving interventions, are all destroyed. The maternity ward has some incubators that seem intact, but this is just the only nice part of this assessment. The buildings themselves are burnt down, walls are missing, there are holes of shrapnel and fire all along them, and the specialized surgery building that used to shelter all surgical specialties is now having a huge crater from the basement to the second floor. On the way forward, we are sure that these buildings have to be evaluated by specialists and by an engineer so that we can know whether their structural integrity is still viable or not. Because to my eyes, as a surgeon and as somebody who does not know of engineering, I do not think that it would be possible that these two buildings will be rehabilitated. Moreover, it was shocking to be realizing that the hospital's open spaces were filled with makeshift graves for people that lost their lives there. Some of them they had some names on, some of them they had not their names on. And it was really shocking as well to be seeing that we had bodies that had been left uncovered or covered with some plastic sheet on the sides of the buildings. WHO, along with other UN agencies, organized a process for the dignified burial of these people. We made sure that each remains were put in separate body bags so that they could properly receive burial rituals, and secondly, be identified using DNA and forensic practices in the future by their families so that their families can find some consolation. We still stress that right now, Gaza Strip's bigger hospital was the only one that could provide with the support of medical oxygen in the north of Wadi Gaza Strip. This means that right now, medical oxygen can be produced only in one small hospital, Kamal Adwan Hospital, which is a pediatric hospital, and obviously the quantities are suboptimal. From a medical perspective, after this destruction, we feel that we are returning 60 years before, when medical imaging was not available, where laboratory tests were not available, and doctors and nurses had to be used only the clinical to treat and make patients better. We want to stress again that hospitals should never be militarized. And I would like to thank you for your time, and I'll stop here.
Thank you very much. The line at the end was not perfect, but we understood everything. So I'll open now the floor to question, knowing that, as we said at the beginning, we will also have at 11:30 the briefing by Mr. McGoldrick, very much on the same subject as he was in Gaza very recently. Let me see if there are questions in the room. I'll give the floor to Nina Larsen, who is the correspondent of the AFP, the French news agency.
Yes, thank you. Thanks for taking my question. I was wondering if you had details on how many bodies were buried and found within Shifa, and then also on the issue of wanting to rehabilitate the other hospitals. How much access does WHO have there, and what do you think the possibility of doing so is, especially and in bringing in this advanced equipment that Dr. Pieperkorn was talking about? Thank you.
Panos? You need to unmute yourself on your side. We unmute you here, but you need to do it on your side. Go ahead.
My apologies. Thank you very much.
No worries.
Thank you for your question. I can talk only of what we saw when we were there. So while our presence in Shifa was only some hours for security reasons, we found remains of 8 bodies there. However, more they're buried in a makeshift cemetery in one of the open spaces, and more were remaining under rubble, and some of them visibly seen under plastic sheets. So unfortunately, I cannot give you precise numbers, but I can surely say that while we were there, we found remains of 8 bodies. Regarding the other question for rehabilitation and access for elaborate equipment and supplies, as Dr. Peppercorn explained before the war, it was extremely difficult to bring inside Gaza these pieces of elaborate equipment. Rick, would you like to give some more information on this, please?
Well, yeah, I can add. So, just as an example, for example, I think I raised this already, that over the last 2 years, I recall that we wanted to assist with, I think it was 10 mobile X-rays for Gaza, and it took us almost 2 years to get 3 in. I mean, in location and in place, and that shows a little bit the paperwork, the red tape, the bureaucracy around all of that to get this kind of specialized equipment in. But I want to be clear on this. I think not that I'm positive at the moment and in a positive mood, but I think we have to. And if you look at, we have to look forwards, and then you talk, of course, about pragmatic rehabilitation of hospitals. So first, in this current phase, well, there's still a war going on. So how can they become again partially or minimum functional? And then you look, of course, on how can they become a trauma stabilization point? How can they deliver some outpatient department activities, primary healthcare, etc. You focus on the basics. Can any of the emergency medical teams assist in this process? So we are also coordinating emergency medical teams, and 1 or 2 have reached out to us and said, well, we are willing, if feasible, and of course it all depends on the security, and if feasible, to assist there as well. So we're looking at this kind of combinations. And then, so I was, in that sense, I think it was a little bit of a spirit, positive spirit, when we were, for example, in Al-Amal Hospital, the PRCS hospital. So first to meet the director and the staff, and to hear that, okay, they were still trying to treat some trauma patients when they came in, and even some maternity, and they were trying to push to open up some of their work again over the coming week. Well, we of course have to assist them as good as possible. The same applies for Nasser Medical Complex. But if you look at proper rehabilitation, then I think I described that in my introduction. We need much, much more.
Yes, thank you very much. So I'll go to John Zarocostas, The Lancet and France 24.
Yes, good morning. My question is to Dr. Thanos Gargavanis. Kalimera σας. I was wondering, sir, if you could elaborate on the loss of medical oxygen, what is being done to bring in supplies, since that is critical for many of your interventions. And secondly, the loss of such a big referral hospital, what does it mean now for all the patients? Where are you going to redirect them?
Thank you, John.
Thank you very much, John. Kalimera. First of all, the loss of medical oxygen for northern Wadi Gaza is a really critical issue. Before this war, Shifa was able to use electricity to deliver oxygen to the north. However, after this attack, the needs are escalating. We are working with all parties to make sure that we make available oxygen inside. However, in the recent past, we have been denied multiple times oxygen tanks as possible dual use items by the Israeli authorities. Eventually, this has been overcome. Right now, we're in a phase where we can import these kind of supplies. However, this shows that the needs are way bigger than what we can actually cover with the existing mechanism for the import of goods and supplies. We have to scale up. Regarding patients in the north, we would like to stress again that right now, there are very few places all along the Gaza Strip, and mostly in the south, that can provide the full set of surgical operations required. And a structured medical evacuation mechanism has to be established. We are not there yet. Medical evacuations until now are ad hoc, haphazard, and have to do with bilateral agreements between the Palestinian authorities and third countries. When a third country says that we can receive X number of patients, then a medical evacuation is way easier. However, we are still in a phase where there's no mechanism in place. There's no standardized approach. And this puts us all in a really difficult situation. We need to go forward to have a standardized medical evacuation mechanism that will be allowing on a daily basis to evacuate at least 50 patients. Right now, the moment we're talking, we have a list of more than 9,000 patients that require to be moved abroad for the continuation of their treatment. Thank you very much.
Thank you. Thank you. We have the time for a last question. Nick Bruce, the New York Times.
Yeah, thank you very much. I just wanted to ask you briefly, what has improved in terms of resupplying medical requirements in the last week or 10 days? And you've talked about the need for a standardized system for medical evacuations. Thanks for that. It was my question. But what's actually holding back you? What's holding you back from getting that standardized system? This is something that's been discussed for a while. What's holding it back? Thanks.
Right now, the current situation is extremely challenging because too many parties are involved. And unfortunately, we don't have a blanket coverage of import of supplies and equipment for WHO. What we are asking for is that medical equipment and supplies and consumables should be not considered as possible dual-use items, because right now the delays are all related to security concerns. Moreover, I would like to add that right now we still have the issue of coordinating with neighboring countries. So until now, again, we have to stress out that medical supplies are not considered as top priority items. And the improvement has to do with bilateral agreements between agencies like WHO and the Israeli and Egyptian authorities to make sure that these items become available on the ground. Rick.
Yeah, I think it's a very good question. First of all, it's Thanos already discussed the mechanism. 9,000 plus patients need to be urgently evacuated. So you need a system of that. So there's a security screening both by the Israeli side, by the Egyptian side. we were asked as WHO already back in November to come up with a proposal, which we did. And we were thinking on batches of 60 to 70 patients per day. And the authorities would like WHO to vet those patients. So it came from the ministry, the hospital directors, etc. Criteria where we added on age restrictions, etc., which became unworkable. And what we've seen up till now is a dysfunctional medevac system. It's a lack of transparency. There's only 2,500 patients have been coming out of that, while we estimate 6,000 to 6,500 trauma-related patients and 2,000 to 3,000 plus medical cases, not forgetting that before this crisis, between 50 and 100 patients daily were referred to East Jerusalem and to the West Bank. And 50% of that was oncology, cancer-related. So that's so we are ready, and we understand that from the Egyptian side, the Egyptian government is ready to receive these patients. Some of the countries in the region have reached out and already have accepted patients, Qatar, UAE, etc. More countries have reached out. Some of the European countries have expressed interest to take patients. We hope that the EU will come together and also be clear that are they able to receive a number of thousands of patients and their companions, etc. Also that we get clear ideas about that. And we are ready to facilitate and to support that. So that's on the other thing, I think Thomas made a really good point. What I'm really surprised about, if WHO is coming up with a list of supplies, etc., like everywhere around the world, we get access to those supplies. Here we struggle in some areas. And the last point I want to make, deconfliction mechanism is still not complete, is still not working. Today's WHO mission to Al-Ahli to deliver fuel and transfer 3 patients were denied. And yesterday our mission to Kamal Adwan, where we would both go to transfer 3 critical kids, patients to the south, was also denied. Over to you.
Thank you very much, Richard. Thanks to you and Thanos for this very important update. As of course, we have come up to almost 11:30. We'll stay with Gaza with Jamie McGoldrick, who's already online. But I just ask Jens to very, very briefly, you have 1 minute for your announcement, and then we will close the briefing and we'll go to Jamie.
Thank you very much. Yes, I'll be very quick. And I've sent you a media advisory. It's for next Tuesday. We have a high-level pledging event for the humanitarian situation in Ethiopia. It starts at 3 p.m. Here in the Palais des Nations in room 23, and you're welcome to join us there to listen in. It's also a webcast on UN Web TV. It will wrap up at 6 p.m. and we will send you the pledging result at that point. We are working on a media availability at noon with high-level representatives of the 3 cohorts, which is the government of Ethiopia, the government of the United Kingdom, and us from OCHA. So that will be noon on Tuesday, and then the event itself at 3 p.m. Thanks.
And I see that Christian has put in the notes that the WHO will also have an Ethiopia statement coming today as well to you. So thank you very much. Human Rights Council asks me to inform you that the Permanent Forum of People of African Descent will hold its 3rd session in Geneva from 16 to 19 April 2024. I don't have time to go into the details, but Pascal will send you the information. So thank you very much. This closes the briefing today, and I would like now to cede my seat to Jens to moderate the press conference with Jamie McGoldrick. Jamie, thank you so much. We know you are in a very tight schedule. It's your last day, and you are coming to us to brief us on these 3 months and what you have seen in your recent mission to Gaza. Thanks for being with us, and the Geneva journalist, Jens, please. Give us 1 minute to change seats. And I'll see you on Tuesday. Thank you. There you go.
Thank you very much, Alessandra, and welcome to this press briefing with Jamie McGoldrick, who's with us online now from OPT. Jamie wraps up his 3-month mission as humanitarian coordinator, as interim there, and has also just been to Gaza, I know. So I will give him the floor for his introductory remarks, and then we'll take your questions in the room and online. Martin, over to you.
Yeah, thanks, Jens. I hope you can hear me okay. Okay.
We can.
Right, thanks a lot. I mean, I was in Gaza a few days ago, just for my last time, and it was quite a sad thing for me to leave after only being here for a short period of time, and obviously not getting all that I wanted done. But I think that some of the things are still going on. I'd like to mention the fact that what we see in Gaza right now, and Rafah in particular, was two things that I think is predominant. One was the fact that people themselves, the citizens there, the civilians, are very worried about the potential of a Rafah incursion. I think that's the first thing. And because of that, you see some of the previously congested areas of Rafah being, more crowds moving away, going to Al Mawassa and other places on the coast, fearing the possibility of an incursion. I think the other thing I would note is the fact that, what recently happened in terms of that tragic event where 7 humanitarian workers for War Central Kitchen died, and given the fact that they were quite well placed vis-a-vis the Israeli government and a much more a privileged position than maybe some of the other organizations, I think the humanitarian workers there then fear for their own safety. And as we know, the deconfliction and notification system has got flaws. And I think these flaws appeared quite starkly in that incident regarding the World Central Kitchen, and something we've been constantly trying to remind the Israelis that this is not a one-off incident. We've had many incidents of that kind, and tragically, as you saw yesterday, there was another bullet shot at a UNICEF car. And so clearly the system that we have in terms of how deconfliction works, how we work with interact with the Israeli Defense Force, and the way we notify and communicate is challenged. We don't have communications equipment inside Gaza to operate properly, as you wouldn't have any other situation. And secondly, we don't have a hotline or an emergency number to call in the case of an emergency incident that arrives. And so it's important that we get that addressed. I met a few days ago with the head of Southern Command of IDF and laid out some of the issues that we face regarding our interaction with the IDF and operating generally inside the Gaza context. Maybe just sort of some of the details on the ground. As you know, Israel pulled out of Han Yunis a few days ago, but they've also moved into some of the central area camps around Nuseirat. And an UNRWA school was hit twice, actually, a shelter. We had not missions planned for the north today. They've all been cancelled, including a recce that was actually going to go to Erez as part of this announcement by Israel that we were going to open up more corridors and more possibilities of bringing food in and other goods in from Ashdod through Erez. However, the Jerusalem side, the actual, on the Israeli side, there was a mission that went in today to look at the Erez and a place called West Erez, or Zikim, which is on the coastline down south from Ashdod port. There was the interagency mission took place also into Han Yunis recently, following the withdrawal of Israeli troops, and then they examined the status of the infrastructure, health facilities, water points, and storage facilities. WHO reported extensive destruction of the infrastructure, and they actually talked about, some intentional destruction of medical equipment as well. There's a high presence of unexploded ordnance on the route and even inside the area itself. And there was reports of 100 kg bombs being let on the roadside. This is going to be a real challenge for two things. One, for obviously people returning to where these places which people will leave from Rafah desperately to get away from any incursion. And secondly, it will make our challenges of supplying material into those areas difficult because of the threat to that. So we would have to start looking at that in a different way. Anyway, I would also say that the conditions on the ground haven't improved in any meaningful way. I think there's going to be the immediate thing, which is obviously what we face just now, the challenge of water. This is becoming very hot there now. The water supply system, people have got very much less water than they need, and as a result of that, waterborne diseases due to the lack of safe and clean water and the destruction of the sanitation systems. they're all bringing about problems for the population living there. As a result of that, there's been a lot of illnesses that have arisen, which are waterborne disease illnesses. And so we have to find a way in the months ahead of how we can have a better supply of water into the areas where people are currently crowded at the moment. And as we know, the hospital system there, Shifa and Nasser, the two big hospitals, have been badly damaged or in fact destroyed. And what we have now is 3/4 of the hospitals and most of the primary healthcare clinics are shutting down, leaving only 10 of 36 hospitals functioning. We hear of amputations being carried out without anesthesia. Miscarriages have increased by a massive number. And I think all of those systems which are not in place, are the soaring rates of infectious diseases, hepatitis A, dehydration, respiratory infections and diarrhea. And obviously, given the fact that our supply chain is so weak, we haven't been able to deliver enough assistance into the north part of Gaza. We've had in the last, since the road opened on the military side, we've had 8 convoys. And that's not every day. The other roads, the Saladin Road in the south, the middle road is not working because it's inoperable, because it's destroyed. And the coast road hasn't been open for almost a month. So we have a very limited supply into the north. I was up there a couple of weeks ago. I went to Kamal Adwan Hospital and saw myself inside the actual hospital, the children's ward. Every single patient there was facing really serious food insecurity issues, dehydration, emaciation. And we'd heard from Dr. Usman, who was there, that a child had died the day before, one who was in that ward. So a very precarious situation. WHO and UNICEF are trying their best to get more material in there in order to try and satisfy that need. And also the fact that, we have to get nutritional, not just general food, but specialized nutritional products for children. I then visited the neonatal ward, and there's lack of incubators. Children doubled up in the incubators. And then the last child I saw was in an incubator who was two days old, a boy, but who wasn't prematurely born in 9 months, but he was 1.2 kilos. So low weight birth is going to be a real problem, I think, for children of that kind, people who are not getting nutritional. There's going to be long-term consequences which will be felt, and the development possibility of that child, of those children, are going to be quite limited, I would say. We've heard from Israel a lot of announcements of them over the last days, of the fact that they want to open up and be much more supportive of that. One of the claims they also say is that they've put in 1,000 trucks over the last few days, entered into Gaza, and only around 800 have been collected by the Palestinian side. There are challenges in that regard, because the number scanned by Israel doesn't correlate with the number of trucks being collected and dispatched inside Gaza. There's many reasons for that. We have to load and offload the trucks that come from Israel. Israel believes that their responsibility ends when they deliver trucks from Kerem Shalom into the Palestinian side. And I would say that that's certainly not the case. Their responsibility ends when aid reaches the civilians in Gaza. And we have to have them supportive of that. And that means allowing more facilitation, allows more routes in, and obviously to provide security for us as we move. At the moment, we don't have security. The blue policemen who were there before are no longer able to do the job of securing convoys, of crowd control, etc. We don't have that anymore. And so what we have instead is the possibilities of getting ransacked and looted, which is a common occurrence in a place where people are very desperate. And it's a common occurrence when places are very congested, the roads are in bad shape, and we use very predictable roads to move goods around. So we face real law and order problems, and there's a security vacuum there that's been filled by various groups. Some of them, we don't know who they are, but they're there because of organising traffic control. You see some guns, AK-47s and pistols around. So there's clearly groups that are there, and there have been incidents recently when we're coming out of the Rafah Blue Gate, when you have smugglers who are there waiting to get the cigarettes that have been brought in from Egypt. There's always a squabbling over who gets them, because it's a very high value commodity. And most recently, there was a couple of gunfights outside the gate where we normally go, and a couple of people were shot and killed. And so that's the environment we're working in. And it's very easy for Israel to say, we've sent you 1,000 trucks, so please deliver them inside Gaza. I say it goes on much more than that. Well, for example, we are trying to move goods around and move goods to the north. There's 3 roads there. We've mentioned the middle road, which is Saladin Road, the coastal road, which is Al Rashid Road, and then there's a military road on the east side. At no point in time in the last month and more have we had 3 or even 2 of those roads working at the same time simultaneously. And the roads themselves are in very poor condition. And also when we do use the one road, which is the Saladin Road, where yesterday where UNICEF was shot, what happened there was that we were held, there's a holding area at the checkpoint, and we are held there for hours. And so far this month, we've wasted 60 hours of trucks going up there, downtime, on dead time, on convoys. And this means that those trucks, those people are locked into that place for a long time. And then what happens, sometimes it's too late in the day because we can only travel in daylight hours to go north, and therefore sometimes the mission is cancelled. And then we get blamed by Israel for cancelling the convoy, or cancelling the mission to the north. And we need to get a better understanding from them of what that looks like. I had a meeting this week with Major General Finkelman. He's the head of the Southern Command of the IDF. And we talked very openly about some of the things that are missing. This came as a result of the World Central Kitchen issue and the complaints we made about the deconfliction and notification system being wrong, not being working, not predictable, not protecting humanitarian workers. We talked about the communications challenges. We are working in a very hostile area as humanitarians without the possibility of contacting each other. We don't have radios, we don't have mobile networks that work. And so what we then do is we have to find ways of passing messages back to OCHA and other organizations in Rafah and then relaying it out. And if we have a serious security incident, we don't have a hotline. We don't have any way of communicating the IDF if we're facing problems at a checkpoint or facing problems en route. And I think there's another thing I would say, that there's a real challenge of weapons discipline and a challenge of the behavior of soldiers at checkpoints. And we've tried time and time again to bring to their attention, whereas I think one of the things that we should understand, that the IDF have never worked with humanitarian organizations before in this type of environment. They don't understand how we function. They don't understand our language, what our purpose is, and we don't understand their expectations. And there's a degree of mistrust and misunderstanding that we have to address. And this meeting with Major General Finkelman of the IDF, I think hopefully helps that, because he said, he told us that he sees us as we're not against them. You're working and serving for a good goal, and it's a challenging environment. So, we want to work with them differently. We want to find ways how we can speak to soldiers in a way at the checkpoint that's more respectful and more trustful. And that's something he said he would take forward and help move that. He talked about markings on vehicles that have to be much more clearer in terms of showing the UN or the NGOs working there. And we need to have much more regular engagement with the IDF. Right now, that's the first time I've met them since I've been here. And we have to find ways of having a joint operations cell, which we can then discuss some of these challenges, and then also to have this hotline or this number that we can call in the event of a crisis. But more importantly for ourselves, we need communications equipment. We need to get mobile phones, we get 3G, we have to get VHF repeaters, we have to get sat phones, all of the things we need as we have in any other operation. This is an operation I've never seen the lack of communications equipment in a very hostile environment. And then we've also had discussions this week on the US pier, this new temporary pier, the floating pier that's talked about. We've been discussing about how that's set up, how it looks like, and then ultimately how we would operate or interact with it. There's still work to be done on that in terms of what it is. We'd hoped that the pier would be in the north of Gaza to address the imminent famine challenges in the north. And we would hope that's where we could actually do the work. However, it's been decided that it would come south, and it would be where the IDF have a base or have a compound and have a military road, and that's where that will now be there. We have still some concerns over the perception and the neutrality of the project, and because in many ways the plan or the operation that's been set up actually embeds us in an IDF surrounded perimeter, and I think that's difficult for us. We've had conversations with US CENTCOM, we've had conversations with the US government, and obviously with the Israelis as well, to try and come up with a solution to that. So it remains to something. Martin Griffiths, the ERC, put out a statement yesterday on the neutrality and perception issue, and we're trying to develop a paper which will try to give us operational clarity on how we need to work. We've had a lot of new developments from Israel. They've made a number of announcements in terms of how they wish to open up things differently, different types of commitments. We are, as the UN, committed to using all possible routes to scale up humanitarian assistance throughout Gaza. But right now, we see that there have been a number of commitments made by Israel, a number of concessions, we would say, things that we've been pushing for months to try and get a better way into that. We think it needs to be done in a way so we can get safely and timely assistance into the people that need it. And we've repeated the request for more openings. So what they've said is they're going to give us a coordination cell, which will be established with the humanitarians directly, including the IDF Southern Command. And then also the plans to open up areas, as I mentioned, the assessment today, and have selected materials coming from Ashdod, which would be a simpler delivery from Ashdod directly into north of Gaza. And the idea would be to try and increase the number of trucks coming from Jordan through the Allenby Bridge towards Gaza. And the idea is to try and open up the two areas where the scanning's done, the Kerem Shalom and Nitzana, to have much more operating hours, to have extended operating hours. We don't, at the moment, it's not open on a Saturday. And also the daylight hours are much longer now, so we should try and capitalize on those. And then there's also a commitment to actually approve the Nawal Oz waterline into North Gaza to get that restarted again from Israel. So these are the commitments out there, and we are working with the Israelis now to see if we can get that moved on so we can actually have a better performance and a better response to the crisis in Gaza. I'll stop there if that's okay, Jens.
Thank you very much, Jamie, for this very comprehensive overview. And just on a question that was raised, Mr. McGoldrick is speaking from Jerusalem. And we are looking at providing you with a transcript when that is available. I want to go to questions now. I want to see if there is in the room, and I have Nina Larsen first from AFP, and then Gabrielle from Reuters, and then I have a few online. So Nina first.
Thank you very much for taking the question and for this briefing. I was wondering if you could say a little bit more about specific commitments you may have received from the Israelis when it comes to resolving the difficulties, the many difficulties that you mentioned around the deconfliction and around getting aid through. And I was wondering in particular if, sorry, just a second. Yeah, sorry, that's it. If you could just say a little bit more about that, thanks.
Sorry, could you say that specific? I didn't hear the specific issue you asked for there. Is it to do with the commitments?
Sorry, yeah, it was about actually it was about the communications. I was wondering about the issue you mentioned about communications equipment lacking. Why is that specifically that you don't have that equipment, and what is it you need to get it? Thank you.
Okay, no problem. Shall we take the Reuters one as well first, and then I'll do the two together?
No, thank you. Normally we take them one at a time.
Okay. No problem. Thank you. Yeah, I mean, we've been asking for a couple of things since day one of the Israelis. One has been the fact that the deconfliction system we have is not directly with the IDF. We go through CLA, which is a coordination liaison administration office, and then we deal with COGAT. We don't deal directly with IDF. We need to be speaking to people who are firing guns, who control weaponry, and we have to build up an understanding from them and ourselves of how we work. The deconfliction system has been consistently inaccurate, and it hasn't worked in our favor, to be honest with you. There have been so many incidents, and we've been saying for a long time to the Israelis, warning them there's likely to be an incident that will come up, which is going to be quite a tragic one. And it happened 2 weeks ago with the World Central Kitchens. We've said to them that the deconfliction system and the notification system are not fit for purpose. We have to find a way of revising those. And that's one thing. And then as part of that, in order for us to interface with military and when it's an emergency is underway, we have to have a hotline and the ability to speak to them. And in the case of any incidents we cannot, if you're sitting in a car and you've been caught up in a firefight or there's bullets or something happening there, you have to relay that message back through the office and then to CLA and then to IDF. and this is a long way round in the middle of a very, very hot emergency. That's the last thing you need is delays. And that communication problem was highlighted in the readout from the World Central Kitchens issue. So we've asked for communications equipment from the very beginning. We've given pages and pages to COGAT on the specifications, on the needs we have in terms of, we need to have mobile networks, so with 3G, we have to have we have to have BGAN SAT systems, we have to have handheld radios, VHF radios, all the things you'd have in any normal normal crisis. We don't have them. The reason why Israel give us is the fact that they say to us that those communications equipment might fall into the hands of Hamas. And as far as I'm concerned, we have the ability to switch those off at a central source. So that's not an excuse for me.
Thank you very much. Gabriel Rojas.
Thank you very much for the briefing. Just a quick question regarding COGAT figures about the number of trucks. I know there has been some disagreement in terms of how to count what aid is actually going through the crossings. And COGAT is called the way of the UN has counted as flawed. What is your view on how these supplies are counted? Because according to what COGAT says, it's almost pre-war levels, which is not in fact the case. Thank you.
Well, maybe just to say that pre-war levels were 500, 600 a day that were processed but not scanned. They're now being scanned. It's a much slower process. I would say we used to get like 600 trucks in a day, but you should also remember in those days, probably about 1/3 of those trucks, even less, were humanitarian. The rest were private sector. And so when they say there's more trucks now of humanitarian than before October the 7th, that's true. But we were not the bulk of the food, the bulk of the supplies that were coming in. So that side of their argument is questionable. The second thing I would say is that the numbers, I mean, they're using, for example, smaller trucks than we do. And then we bring the trucks into our side and we load them onto bigger trucks, trailer trucks and stuff like that. So we have less numbers of trucks going out. We also get trucks at the wrong time of the day for us to be able to offload, put on warehouses, reload and get out to Rafah because of the security and the timelines. And also I would flag to you that all the trucks that come in and they mention the numbers, that all also includes large numbers of private sector. These are not all humanitarian, but we are responsible in their eyes for taking the humanitarian, taking the private sector commercial trucks and cargo into Gaza. So I would say that there's obviously, we have problems in terms of our ability to move stuff through quickly and offload and reload again. It's a hostile environment. And as I said earlier, I don't think that Israel can say that they give large numbers of trucks from Kerem Shalom and the Israel side into Gaza when it actually goes into the holding area where we have to process them, reload them and offload them and back again. And so I think that their responsibility, Israel, ends once it reaches the civilians of Gaza. So we should count the number of trucks we get to the north, the number of trucks we get out. And the reason why we don't get them out is because of the insecurity. The reason why we don't get them out to the north is because they don't approve the convoys that go north. There were, again, 2 convoys set for this morning that were cancelled. There was another mission set for this morning as well and cancelled. So while the trucks come out in big numbers from Kerem Shalom and Israel's praising itself for that, you also have to remember there are complications for us to logistically deal with it, but then more importantly, to actually secure our way out, and then lastly, to get permission to go out with those trucks to the north.
Thank you, JB. We have one question from Japanese press, and then we will go to Isabel Saku from FA Online.
Yes, thank you very much for doing it. I have a question about the coordination unit. When actually will the coordination unit as a direct contact with the Southern Commander will be established if IDF indicated the timing of it? And then also you succeeded Miss Lynn Hastings, who was denied renewal of her visa in Israel. And I'm wondering, and now you are completing your 3-month mission. And I was wondering if this 3-month period is already agreed beforehand, or this is sort of 3-month period is unexpectedly complete, and then who will be the successor of your post? Thank you.
Yeah, maybe I'll take the last question first. I mean, I was only ever meant to be here for a bridging period, and that was to be around 3 months. It's almost 4 months since I've been here. In that time, the UN system has been recruiting a replacement, a permanent replacement. That's done as far as I know, and I hear that the Secretary General will make an announcement shortly. I don't know when that would be, but I know it's imminent. In terms of your question on when this IDF sort of this coordination cell will be established, we have a cell already right now, which includes CLA, COGA, and ourselves, the humanitarians. The missing part of it, as I mentioned, is the IDF. We were told that by the general, the Major General during the week, he will put one of his IDF members in there. I think that helps with the operational level of things, but I think we also have to have a higher level discussion on a regular basis with Major General Finkelman and my successor to make sure that some of the operational issues that are being addressed in the cell will also carry out and come to fruition. So I think what we're looking for is a 2-level of that, and that's not something that we've worked out yet. But we've seen and heard the commitment from the Major General, and we're going to keep him to that commitment and make sure we get that set up and running as soon as possible. And with that, to complement the use of a hotline and also to have better communications equipment inside Gaza.
Thank you, Jamie. Now, Isabel from Spanish EFE, and after that, Nick Cumming-Bruce from New York Times. Over to you, Isabel.
Yeah. Yes, hello, good morning. Thank you very much. Isabel Saco for the Spanish News Agency. My question is on, I have the impression from what you have said during your remarks that the situation for the humanitarians have not improved in any terms after the incident with the humanitarians of the World Central Kitchen. So could you confirm this, even if you have had this meeting with this general, that the situation remains the same? You mentioned a bullet into a car of UNICEF yesterday. Could you give some details? And if the situation doesn't really improve for the humanitarian aid coming into Gaza and being distributed to the civilians, what do you foresee will be the situation in the next weeks inside the territory? Thank you.
Thanks. I don't think there's been any notable improvement in terms of our ability to move around. Certainly not our approval to get convoys going to the north. They've been blocked again today, as I said. The incident you mentioned, UNICEF, what happened was the mission had gone and was held at the checkpoint. At the checkpoint in Saladin Road, there's a holding area where the trucks and cars wait until they give them the green light to cross over. And in that time, I heard there was a shooting incident that took place. And as a result of that, there's a bit of a firefight between the Israeli forces and another I don't know who the other person was. But as a result of that, 3 bullets hit the UNICEF car, and luckily no one was hit. Earlier in the week, there was also an incident with a WFP car as well, a vehicle which was caught up in a firefight as well. So while the World Central Kitchen issue has happened, and it's a tragic incident, and there's been a lot of reports back from the Israelis about miscalculations, about mistakes, about these things, I think it just brings into stark focus how unpredictable the system that we use for our own protection and safety is not working. And I think it's something we have to continue to ask for improvements. And that meeting this week with the Major General Finkelman at the IDF Southern Command was exactly for that purpose. And along with ICRC and the US humanitarian envoy, we pressed the point that we have to have a system that allows us to be safe and to be protected. And that's the responsibility of Israel as we operate in the territory that they occupy.
Thank you. Over to Nick, New York Times.
Thank you, actually. Isabel pretty much asked the question I was going to ask, but I mean, it seems to me that in the last 2 weeks, nothing has significantly changed. There may be a little bit more supplies coming in, but the system is still the same, and none of the concessions that seem to have been mooted after the World Central Kitchen crisis seem to have been operationalized. Do you have any timeline for getting supplies in from Ashdod Port and opening the Erez crossing? Thank you.
Yeah, thanks a lot. Yeah, no, to be honest with you, we see the big numbers that Israel announced are coming out of Kerem Shalom, but that doesn't mean they then get delivered inside, as I mentioned earlier, some of the complications that we have to face and the fact that we don't get convoys to the north on a regular enough basis. Those are the working environment that we're in. The concessions we made were very welcome. I think there's something we've been asking for a long time from the Israelis, and they, after the tragic incident of War Central Kitchens, have taken it upon themselves to make the announcements. All we can do is keep pressing them for that. I mean, we were supposed to do I was supposed to do a recce this morning to the Erez crossing into the Ashdod and the Zakim crossing, but that mission was cancelled because of insecurity. So we will continue to remind the Israelis of what we want from them, what we need from them, in order for us to make the humanitarian situation better. And that means complicity with them. It means working with them to open up the Ashdod, to open up the Erez or whatever crossing in the north, to hopefully get Carney back on as well. And at the same time, have the 3 routes which are in the south to the north are opened up and functioning. And it's not the case at the moment. So all we can do is keep reminding them and using the pressure from key member states to remind Israel of the commitments they've made and the commitments that we've been asking for such a long time. It's not something that's come as a surprise to us. It's something we've been pushing for from day one, and they've now seen it's necessary to start considering those. I would also caution the fact that when they talk about Ashdod to Erez, they've also used the word temporarily. And there's a worry is that it's only for a short period of time and then they'll close it down again. That would be an essential lifeline into the north, because that's where the population, according to the IPC, the recent famine committee report, that is where the bulk of people who are at the most danger of slipping into famine. And that's why we wanted the Ashdod port opened up into Gaza directly. And that's why we were hoping for the floating pier that would have been more northerly based in order to address the issues in Gaza City and the north part where the bulk of the population are.
Thank you, Jamie. I have Isabel Sacco from EFE with a hand up again. So back to you, Isabel.
Yeah, thank you very much. I had a second part of my question that you didn't answer, and it was about what do you foresee as the situation in the next weeks if the access of the humanitarian aid doesn't improve, given the situation of famine in the north and the situation also in the south of Gaza. I could maybe take the opportunity also to ask, did you have any exchange with this Major General about the plans of Israel that has made public to make an incursion into Rafah? And did you discuss this with him? Thank you.
Thank you. On the weeks ahead, if we don't, it's not so much what they've told us in terms of concessions. If in the weeks ahead, if we don't have the chance to expand the delivery of aid into all parts Gaza, but in particular to the north, then we're going to face a catastrophe. The people up there are living such a fragile and precarious existence. We've had 8 convoys to the north using the military road over the last month. There's been very intermittent commercial traffic has gone up the coast road. It's not enough to satisfy the needs which are there, and they're massive. And we can see by the health situation, we can see by the nutritional, the way that children are starting to show real serious signs of malnutrition. And the fact that the IPC Famine Committee report highlighted that 70% of the population up there were in real danger of slipping into famine. So we need to see a change in that, but we haven't seen that happening. And we hope that the announcements are made, we can hold them to those words, and we can open up more pipelines and more entry points to the north and elsewhere to get more roads operational, to get more supplies in. And it remains to be seen, but right now there's been no visible difference in the changes that we've seen on the ground. And I think Israel knows that we're in a very precarious position, and Israel knows that they have to be seen to be much more permissive towards what we're trying to achieve as a humanitarian. In terms of the Rafah planning, it came up in the meeting in the sense that we flagged it. I flagged it as an issue that we were concerned about, but clearly we're not going to get into discussion on the actual military aspect of it. We know politically, we've heard people saying it's imminent and others saying it's not imminent. We saw that there was a differentiation of words from, for example, Prime Minister Netanyahu versus what Defence Minister Gallant said. So I don't think there's really a clear way forward. We have been insisting since day one, though, a couple of things. One, we would require time to be able to prepare and pre-locate or have in place where people might move to supplies. We can't do that right now because we don't have enough supplies coming in on a regular basis. We're barely able to feed the people and support the people currently. And if we were to add on another dimension of that, a contingency planning process for a Rafah incursion, we are nowhere near ready for that. We cannot pre-position material we don't have. And if people are looking for water and sanitation at a time of real problems in terms of weather and the shelter issue, as well as our food supply issue, and then the health system is no longer functioning. As part of our own planning, we've set up emergency medical field hospitals all the way up the north, at the middle part of Gaza, and that would be then to try and accommodate if the Rafah Gaza gets locked into some sort of military incursion and we can't operate from there. The health system itself is in really bad shape. As you know, there's only 10 out of the 35 hospitals that are working, and barely 2/3 of the primary healthcare centres are no longer working either. So we face a real dramatic situation ahead of us. And if there was to be a Rafah incursion, I know the figures that they're mentioning of evacuating some 800,000 from Rafah. There is no space, as we see it right now, in Al-Mawassa or anywhere else on the coast where you can accommodate that number, because there's 400,000 plus people already there. So we are in an advocacy mode to say this shouldn't happen. And we're also at the same time ringing the alarm bells that we're nowhere near ready if we had to address the needs. We will not be part of any helping the people move, will not be part of any evacuation, but we have to stand ready if we can to support them when they do arrive at another destination. Some people having been displaced for 5 or 6 times already.
Thank you so much, Jamie. Just looking in the room and online, and I don't see any more questions. So I think we can wrap it up here. But as this is probably the last time we see you in this capacity, I just want to thank you very much, Jamie, for your transparency and your availability for the press in this very important job. And then perhaps give you the last word that we want to tell the media on this occasion. Over to you.
Thanks a lot. Thanks for that. Thanks for the opportunity of telling people, what the situation is. We know that the international media is not present inside Gaza, and it's important that we as humanitarians bring the stories and the issues out so that people can see for themselves and hear for themselves. Sadly, that's not easy. We face a lot of challenges on the ground to serve the population there. I think we have to flag the fact that, national staff are working for organizations like UNRWA and other INGOs. They are really struggling in the sense that they've been affected themselves by the crisis. They've lost loved ones, their family, their livelihoods have gone and past them, and now yet they come up to work every single day, working hard to support other fellow Gazans. And I think we have to admire that approach, that resilience, and that's where the hope is. I mean, Gaza's been through a lot of crises in the past, nothing anywhere close to this one. It's massive, and so we then have to find a way to be better able to support them, better able to give them a chance and give them some positivity. And I would also just to thank all of the humanitarian workers currently under real serious challenges in the Gaza context. And they come to work every day and they put their head down and just get on with it. And for me, it was a real honor to be part of that. So thanks, Jens.
Thank you very much, Jamie, for those words. I'm sure they are appreciated in Gaza and elsewhere. So with that, we will end this press conference. Thank you for your participation. Thank you.
Thanks a lot. Thank you. Bye.